the landscape of medicine is changing so much, which is why I wanted to bring you on. Again, if our viewers don't know, I own Treasure Coast Heart and Vascular as a non-physician owner. So I understand the administration, the cost associated with running a practice. Thinking about doing that from a physician standpoint and having to do all the administration on the back end, all the financing, all the financials, it's a lot to take on.
It's a lot. It's a lot.
So explain that to me over the last couple of years when you were in a regular private practice.
Sure.
What your regular day was like.
So traditionally, I was never an owner in the practices that I had participated in South Florida. So for me, it was mostly seeing patients, doing the day-to-day doctor stuff, similar to working at Cleveland Clinic or what have you. When I moved up here and decided to open up my own practice, I started with 0 patients, and at that point, you're basically looking at it like, how many patients do I need to pay my electric bill, to pay my rent, all those different things, and eventually, it builds over time.
Especially with again, when you have the personality that you do, and patients start to talk. So I'm sure that wasn't that long of a period. Wasn't all that long.
Thankfully, the majority of our patients were through referrals of either other patients or family members. Some people would say they found us on the internet or what have you, but majority of the patients were found that way. Over the course of 3.5 years, we went from 0 patients to 4,000 patients.
That's incredible.
So it was pretty exponential growth.
That's incredible.
Yeah, it's something I'm really proud of, because I know that we wouldn't have been able to do it if if obviously we weren't getting good feedback from patients. It wouldn't have.
You weren't providing the proper care.
Yeah.
So regular internal med primary care practice, 4,000 lives that you're managing. So you're seeing all those patients on a day-to-day. After work, you obviously have to make sure that all the bills get paid, that payroll's getting taken care of. How do you manage all of that?
Well, there's been a lot of changes to my practice as of late, and I can talk about that as well. But I went from a sole practitioner with, I guess, 1 or 2 employees, 1 initially and then 2, to a practice that became a gargantuan practice that involved 12 employees, 3 nurses, and a very large, over 3,000 square foot office, and obviously managing all those things. It got to the point where initially I was the one handling all of everything day to day, and then it became very difficult to see patients as well as manage. So I had to get a manager as well to kind of offset some of that stuff for me. Still was involved, but there was a lot to do.
And what most people don't understand on the financial side of this, and I don't really want to get into too much of this, but as a practice grows, especially in a situation like yours, your costs continue to go up because you need more and more people to be able to manage all of this. Reimbursement for the last 10 years now has consistently been going down. So it's a very tough struggle to be able to afford all the staff that you need to be able to care for all these patients with decreasing reimbursement every year.
The problem is with the declining reimbursements of insurance companies for seeing patients, the increased expectation upon us in terms of rules and regulations the government has started to implement in terms of patient safety, and many of these things are important, but some of them are extra work that is non-productive and has no positive outcome that has been shown in studies that have done post looking at these things. I found that in order to keep pace with the expenses I was seeing, we were having to see more and more patients. And it got to the point where I began to believe that the care wasn't as good as it should be, because you're worried about that patient in the lobby instead of worrying about the patient you're sitting with at that time.
It becomes a numbers game, and a lot of practices fall into that mode.
And I was actually at a point where I had 3 nurses. I was contemplating hiring another nurse, which would have meant another person at the front desk, another person to help with billing. One little change has so many effects in terms of the expenses that in order to keep pace with it, you have to add a lot of patients to be able to kind of counteract that.
And then, just like you said, it becomes a numbers game where all you're thinking about is how many more patients do I have to add in order to be able to afford this.
Correct.
And there's only so many hours in a day. There's only so much time that you can spend with each individual patient.
Correct.
To the point that if you're only spending 5 or 10 minutes with each patient, how much are you really getting to
I really
understand that patient's issues.
I really believe in the quality of care that I provide. It's something I pride myself on, and I never want to be one of those doctors that's seeing a patient and says, you know, it's been great seeing you today, but unfortunately we don't have any more time. We're going to have to make another appointment for these problems. Because, you know, it's difficult for people to get into the doctor's office, or maybe they're apprehensive because they're afraid of doctors or whatever, and you have them there. This is the opportunity to take care of those things. And, you know, there's many instances, I've talked to patients about it, and I know doctors also that have this happen in their office, and it's just a matter of this is the way it is.
So you might not know it because you're coming from the primary care side, but from a specialty side, if we have a patient that we find that doesn't have a primary because we believe that primaries are probably the most important role in the way that medicine should be delivered.
Mm-hmm.
If we find somebody that doesn't have a primary and we try and send, a lot of the times for a new patient, they're waiting 8 weeks.
Yeah.
So there's a need for more primary care physicians, and there's a need for more primary care physicians to be able to spend more time.
Mm-hmm.
But again, it's a numbers game. So you've got all these guys that are so busy that can, you know, that
Mm-hmm.
you've got to push a patient out 8 weeks. Well,
Sure.
how much time are they really able to spend with the patients that they have now? So that's why what you're doing currently,
Mm-hmm.
I think, is so interesting, and I'm hoping that our viewers find it
Yeah.
interesting as well. So you're running a regular practice the way that it's been done for decades or whatever.
Mm-hmm.
It gets to the point that you realize your care may be diminishing just because of the financial burden that's on your practice. You've got to see a certain amount of patients in order to do that.
Mm-hmm.
So what did you do?
Well, you know, one of the things you touched upon is, you know, a lot of doctors are overwhelmed and patients can't get in. I myself, as of December last year, was booked out 9 weeks. So patients would call and they would say, hey, I'm sick, and they would say, well, we'll put you on a cancellation list, but unfortunately Dr. Dameron has no availability. And that's horrendous. If you're sick, you need to be seen today, and certainly if you can't get in to see me, then it defeats the whole purpose of having a doctor in the first place if you have to go to a walk-in clinic or an ER or whatever. So I looked at it, and I talked to some doctors in the area, and what I actually decided to do is to come up with a practice model. I call it concierge because it's something that people can kind of wrap their heads around, but the actual model is called direct patient care.